Welcome to the Orthodontics and Summary Podcast, where Farouk brings you the key points and understanding of orthodontic webinars, conferences, and papers in a concise podcast with your host, Farouk Ahmed.
Hello all, welcome to the second part podcast, summarizing the webinar entitled Missing Teeth and Bony Deficiencies, Exploring Dilemmas and Dogmas by Mark Wertheimar. The first podcast focused on the ideas and dogmas, and the second stage focuses on the clinical management of both space closure and some of the challenges with it and Mark's tips, and also space opening and focusing on how can we maintain bone when we've opened space. So starting off with space closure. And there are three key issues associated with disguising a canine as a lateral incisor. The first is the gingival height. The second is that of the torque discrepancy, and the third is the morphology of the canine when compared to the lateral incisor. Now, conventionally, the position of the canine gingiva is at the same level of the central incisor. The lateral incisor is usually more incisal or inferior to that. So, the way that we can achieve this camouflage process of moving the canine's gingiva more incisal or more inferior is through bracket positioning. If the bracket is positioned higher up on the tooth or more gingival, it allows the canine to be extruded as the leveling takes place. That extrusion process brings the gingiva with it, and therefore we have a nice step between the central incisor and our canine camouflaged as the lateral incisor. There are consequences further around the arch though, so if we're going to disguise the first premolar or the bicuspid as a canine tooth, there has to be some compensation for the gingival position. This is achieved again through bracket positioning. This time the bracket is positioned more incisal or more inferior. This intrudes the first premolar or the bicuspid, and that allows the gingiva to go more superior, creating that step between the lateral incisor, or the canine as it now is, and that first premolar disguised as a canine. The second issue is that of torque, and the aim of disguising the canine eminence and moving the canine root palatal as opposed to the typical buccal position it occupies. Now there are numerous methods to do this. One can use a canine bracket and invert it. One can use a central incisor or lateral incisor bracket with surface modification. Mark spoke about his preference of using a lower left 5 bracket and having it inverted, i.e. for the dot to be positioned incisal on the canine. This bracket achieves, with each the MBT prescription, a plus 17 degree of torque. It is also contoured to allow it to adhere to the canine tooth itself. Mark then spoke about the morphological differences between a canine and a lateral incisor, and the lateral incisor is narrower both in mesodistal width but also in labial, lingual or palatal width. This can be corrected through adjustments in size, but also by considering the use of minimal preparation veneers. He spoke about mechanics as to how to achieve space closure. He advocated the use of push mechanics, and he said that, well, if pull mechanics were to be used, it can distort the arch form and also alter the centerline. From an anchorage perspective, the use of temporary anchorage devices in the anterior segment can also be advantageous. He included the section describing space closure and the advantages of it, how it is stable, how there are no 2 stages involved, as we may require if we carry out space opening. There's predictable periodontal outcomes and health associated with it. It maintains the bone by having the canine in the lateral incisor position. There's no prosthesis involved. There's no evidence of any functional problems through this change of the canine position coming to the lateral incisor. Next, we move on to the use of miniscrews to maintain bone. This is the idea of placing the mini implant or the miniscrew into the hypodontia region and therefore not allowing the atrophy of bone to take place. The question is, does this work? Well, in the paper by Al-Matia in the AJDO, it showed that 3 months after placing a miniscrew, the bone density actually increased in that region. So the idea was then taken forwards, and placing a miniscrew and attaching a prosthesis to it was followed up for 5 years by the Carolantini group in 2017, and it showed that the prosthesis remained of the lateral incisor and the miniscrew stayed in situ with that bone also maintained. But not only was the bone maintained, actually the bony development vertically continued as it did in the adjacent sites where the other teeth were. So how does this work? Well, the miniscrew is placed laterally, not in a vertical position which sounds a bit counterintuitive. The rationale behind this is that vertical insertion has shown infraocclusion taking place of the prosthesis and of the bone in that site. How is the prosthesis maintained? Well, there's a spring attached from the miniscrew to a prosthetic tooth. Webinar. Hope you've enjoyed this episode. Please do subscribe and look forward to the next episode.